Hi everyone, myself Dr. Kiran Casey. I'm a dermatologist working in Haldwani, Uttarakhand. So today the topic of discussion is skin. Skin is broadly classified into two layers. Okay, one is the epidermis layer, one is the dermis layer. The layer of the skin which is visible for the naked eye. Okay, this is the epidermis layer. Okay, and the deeper layer is the dermis. Okay, so what does this epidermis contain or what it is made up of. Okay, so predominantly epidermis is made up of keratinocytes and melanocytes. Okay, so for example, if you take our whole body has a home or a house. Okay, and if you consider our skin has the wall of a home. Okay, protective barrier or a wall. Okay, then the bricks of the wall or the building blocks, okay, the bricks of the wall are the keratinocytes. Okay, so this is the basic explanation. What is a keratinocyte? What are melanocytes? Melanocytes are few in numbers compared to keratinocytes. Okay, so these produce pigments, melanin, which is responsible for us to look like this is brown color. So if for you to look brown or any color, melanin is required, which is produced by melanocytes. Okay, so any of the pigmentary disorders, okay, if dark spots, okay, you take it tanning, you're taking melasma, lichen planus pigmentosus. Okay, for every dark spot, most of them there is an increase in melanin. Okay, melanin, melasma. Okay, so it looks darker. If there is a decrease in melanin, you have other types of diseases such as vitiligo, pityriasis alba. Okay, nevus depigmentosus. Okay, there are various other diseases. Maybe in the future videos I will be covering each one of them. Okay, so both increase of melanin causes pigmentary disorders, okay, or dark spots, tanning and all. Okay, whereas reduction in melanin causes vitiligo, okay, all the other depigmenting agents or white color diseases. Okay, white diseases which develop white in color. Okay, so this is the basics, okay, which the epidermis contains. There are further things also present in the epidermis. I'm not going to go in that detail and all. Okay, now let's come to the dermis. Dermis is predominantly formed by one is collagen, glands, blood vessels, okay, and hair follicle. Okay, now let's go on in detail about the importance of each. Okay, collagen. Okay, is the reduction in the quality of the collagen or the amount of collagen which is responsible for the aging changes of wrinkles. If you're developing wrinkles with age, it's because of the reduction of the collagen, okay, or reduction in the quality of the collagen. Okay, reduction in the amount of collagen or the quality of collagen. Okay, now the glands. Usually there are two types of glands which are present in the skin. One is the sweat gland and sebaceous gland. Okay, sebaceous gland has I already dealt in my previous videos about acne. Okay, about how it, which age group it increases, it produces sebum, all those details you can see in my previous videos, okay, about acne. Okay, so next, sweat gland. Sweat gland is usually a gland, okay, from which sweat is produced. Okay, and it opens with a pore, okay, onto the skin, from the pore onto the skin. Okay, next, hair follicle. Hair follicle has a, in the previous video I explained, hair follicle is hair root from which the hair strands comes out. Okay, so you can see my previous video of basic of hair to know more about it. Okay, now blood vessels. Blood vessels, any of the cutaneous vasculitis, okay, vasculitis disorders, okay, usually blood vessels are involved. Okay, so what is below the skin? Below the skin is a subcutaneous tissue, okay, which is predominantly made of fat. Okay, sometimes you might have seen a doctor, if there is a tumor or swelling, pinching the skin. Okay, so if the skin over the tumor of a swelling is pinchable, okay, then the tumor of the swelling is below the skin. Okay, for example, lipoma. Okay, various other examples are there. Okay, now if any tumor or a swelling is attached to the skin, attached to the skin, or if a tumor or a swelling is formed from the components of the skin, then the skin will not be pinchable. Okay, so just to differentiate, the doctor usually pinches. Okay, so this is the basics. Okay, please like, share, and comment. Okay, thank you. Wait for the next videos.